Hey guys, it's coronavirus day 423. Other than the fact that it's Mother's Day, I bring some bad news. So coronavirus cases have gone back to stay at home to the day 32 and coronavirus cases have returned to the 3,000s. I'm going to talk about the fourth wave of coronavirus, which might happen if Canada reopens too fast, and some stuff from Toronto police that they have reported. So, anyways, here we go. So, Ontario reported 3,216 coronavirus cases. So 903 high cases are from Toronto, 752 high cases are from Peel Region, 335 is from York Region, 187 is from Durham Region, and 150 is from Ottawa. So 47 deaths have been reported. UK variants have updated finally with 91,624 since 2 days ago, because they didn't update yesterday. Which is an increase by 2010. 400 South African variants, okay, so +5. And 1,229 Brazilian variants, increase of 17, so anyways, of course, vaccination update. So if you want to book your vaccine, you can go to covid19.ontario.ca/book vaccine. You can book by phone, 1-888-999-6488, or at a pharmacy. And then there is a specific, and there's that vaccine. Also, there's coming to select pharmacies. And I have the update down below. Stay-at-home rules are also down below, and also checkpoint rules for the Ontario-Quebec border and the Ontario-Manitoba border is also there. So let's talk about the fourth wave, shall we? So some experts say the vaccines. So vaccines, and of course, and care. But there might be an end. So, what the experts saying are like, if the restrictions are lifted too quickly, like So if we vaccinate more people and carefully like reopen places without reopening every yeah, it could prevent the fourth wave. And the problem here with is provincial restrictions and rising vaccination rates new are going somewhat lower, but and we're going to bring some word from Dr. Peter Junie. So he said, the province could have avoided a record-breaking third wave if officials have implemented the lockdown several weeks earlier, and we'd have a shorter lockdown and stay-at-home rules. And he said the most important part is like not to fall into the same trap once more and not make the same mistakes again. So Carolyn College, she said that it's also the timing and the severity of another possible surge in Canada will depend on when we reopen, how fast we reopen, and how many people are vaccinated at the time we do it. So, but if we reopen when people are like not all people are vaccinated or the first shot. So Dr. Tam, Teresa Tam, she's so she said that a summer in itself is not enough to protect us against the fourth wave, and of course she said reopening too soon. She said before you hit your key vaccination targets, and of course Ontario hoped to vaccinate at least 65% of all Ontarians, at least and when before summer starts. And another word from Ashley to so an epidemiologist. She works for University of Atlanta School of Public Health. So she the epidemiologist said that if another fourth wave actually does happen in the fall, while provinces are likely lifting restrictions, so she's hopeful that that vaccinations will actually make a difference. So that rise in cases will not spur that kind of rise in serious infections and hospitalization that we have the experience we're experiencing right now. Because of course, if looking at it, ICU cases are high, coronavirus cases are high, vaccination like variant cases are high, and especially the UK variant. She said that, but that doesn't mean that we won't see still see infection circulating. So Dr. Peter Genie said, not so in the fall, because we don't just have the cold that and the flu, but coronavirus cases is going to be yeah. There's going to be three things that we're going to be worrying about in the fall. So that's one thing Dr. Peter Jr. is worried about. So infectious disease specialist Dr. Srinivas Murthy also said the coronavirus will be lingering as one of the that's for quite some time. And he said this winter, regardless of where vaccine uptake will be, there will be cases in our ICUs that will emerge periodically, but hopefully not a full-blown surge. So hopefully in the fall we don't have to experience such things. And of course I'm gonna focus on Toronto police. And the Toronto police, they were not happy about this, and the number of parties and events still being held in Toronto amid lockdown, you know, is concerningly high, though, leading hundreds of people being hit with a $750 ticket this week alone. So, according to Toronto police, so Toronto police said more than 296 charges were laid between April 30th and May 6th. So that's like Friday. Yeah. So like last 2 weeks technically. So so police busted gatherings at places like condominiums, short-term rental places, and closed bars and restaurants. So 16 criminal charges were also laid during that period. So in one case, police said they attended a noisy party in Bloor Street West and Dundas Street area. So that's near the Bloor GO station and Dundas West subway station. And they found 14 people inside a house. So, the Toronto police had to resort to using the EMCPA, the Emergency Management and Civil Protection Act, and also the Reopening Ontario Act, the ROA, and had to make them disperse. So Staff Superintendent Randy Carter said this number of gatherings, parties, and events held across Toronto is concerningly high, and police are being called to attend these scenes on a daily basis. So the Toronto police are thanking people who are reporting these people for breaking these rules, and with the comment, "You are helping to keep our city safe." Since the introduction of the dedicated enforcement teams on April 22nd, police said more than 570 tickets and charges have been laid across the city. So Randy Carter said the Toronto police the team that will out be again to investigate and make sure people are following rules and regulations, not having any gatherings. It's kind of obvious they shouldn't have any gatherings of any kind. It kind of makes sense. So that's pretty much the main reason, contribution why Toronto's coronavirus cases are so high right now. And of course, there's don't forget the enforcement officers do have 100% authority to break up any gatherings of any kind. And of course, the fines go something like this: $750 for every single person who showed up at that gathering. And sometimes they might get charged an additional $130 surcharge might be applied. Portal Police did that for officials who came from Toronto and should have stayed in their area. So 880. So this was through a ride check in Timmins for multiple people from different addresses. So Timmins police did a ride check. They busted him, got him. So ride checks are completely 100% legal. Yeah. So. Also, technically, people gathering for non-essential reasons. So, $1,000 for preventing others from following the actual coronavirus regulations and lockdown rules and stay-at-home rules. $10,000 for those who organized or planned the gathering. Yep. pretty much. They make mistakes. Do stupid, play stupid games, win stupid prizes, which is fine. So hospitalizations today are has been lowered to 1640, which is a minus 192 since the last 2 days. Which I don't really understand why they didn't show it yesterday. $888 and 48 ICU patients. So -3. So slightly less stress for critical care nurses. And 580 ICU patients out using a ventilator, -8. So and they chose not to show long-term care homes deaths, which is kind of fishy. So I still have showed the recent data, which is 3,763 deaths. Staff deaths is still at 11, unchanged, and outbreaks was last time it was at 50. So please follow coronavirus safety rules and regulations and stay-at-home rules. Don't have any gatherings of any kind. If you have any gatherings, it's just going to for those people who really want to get rid of coronavirus entirely, and that means basically all of us. Yeah, doing that's going to take. Instead of making an improvement, it's going to not make an improvement. So, follow Ontario and Quebec border rules if crossing for essential reasons. And for those people who are trying to break the rules, your rights aren't more important than the rest of us trying to lower COVID cases and ICU patient numbers. Stay safe, folks.